Inter-Consumption. We now come to example 3 for yang consuming the yin. Alcohol increases liver yang. So initially, the liver yin can increase. So this is what you call the hangover. In due course, liver yin is consumed. This will cause symptoms of contractures of the muscles and tendons, tremor, dry eyes, lack of control over anger. Deficient liver yin cannot control the rising liver yang. Liver yin stores blood, and when yin is deficient, there could be spontaneous and excessive bleeding, as in the case of when you have liver cirrhosis. Then finally, a reduced state of blood and qi at the end of bleeding. Treatment: sedate the liver yang, tonify liver yin. We use points to hold the blood within vessels and other points against alcohol abuse. We go to example 4. This time we have yin consuming the yang. So, firstly, cold or damp exposure over a period of time. Initially, the yin increases. Secondly, the yang will take over, will try to counter. The yang rises, so this will cause symptoms of inflammation or fever. So this would be the pathogenic yang. Thirdly, the functional qi or the good yang is consumed. So there will be cold and damp exposure consuming the warmth and inhibits the functional yang or qi. So in the case of an inflammation, the pathogenic heat remains high. So the inflammation is the harmful heat, while the good functional yang is, as you can see here. So this is slowing of functional yang qi, or function or qi deficiency caused by long-term cold or damp exposure. So we tonify the functional yang or qi by using the bakshu points and luo connecting points, sedate the yin. If the heat or inflammatory symptoms do not disappear, we add bloodletting or electrostimulation locally in order to either eliminate or disperse the heat. Then we go to yin consuming the yang, exposure to cold. Cold, we know, it can increase the kidney yin. Then the yang increases, causing fever, arthritis, backache, ear infection, pyelonephritis, cystitis. There is a definite history of exposure to cold, and the patient continues to feel very cold, even with the fever. So the inflammation, you'll have yang pain and fever, and the functional qi is reduced. Lastly, the functional qi goes down, while the infection, the pathogenic yang, is still present. So symptoms of qi deficiency will have stiff joints, poor flexibility of back, loss of hearing, water retention, or incontinence. A continued state of inflammation will inhibit the normal functional qi. It is always the healthy yin and yang that are consumed, not the pathogenic energies. So treatment: bladder 23, bakshu point of the kidney, which activates function. Bladder 58, the luo connecting point of the urinary bladder. The patient should be advised to keep warm, although no moxa should be used. Bleeding cup to eliminate pathogenic heat. Electrostimulation to disperse heat can be used in local areas if necessary.